I wouldn't be an academician if we didn't have a PowerPoint. Right? So, by the way, that's Subutex that you're looking at right there. You might think that the maternal instinct would be enough to overcome the drive of these opiate addiction and get these women to quit their habits. Not so much. And that's what we're here to talk about right now. It's a huge problem. I'm going to show you how big and how it's getting bigger. All right. We'll talk a little bit about what was shown in the video, addiction being a chronic relapsing disease. Abstinence, just say no, doesn't work. And how Subutex is not a cure, but it is a tool that can help. The federal uproar started in 2012 at a White House conference where they noted that there was a tripling of the rate of neonatal abstinence syndrome from 2001 to 2009, or 2003 to 2009, up to 3 per 1,000 babies born. This is where we were at that time, all right, at 30 in 2009. By the time we got to 2012, we were at 80 per 1,000. There are still NICUs in this country that kick at the outrageous value of 27 per 1,000 NICU deliveries. That would be a drop in the bucket around here. It seems to have leveled out at somewhere around 13 to 14% of all babies born in Capital Huntington Hospital undergo neonatal abstinence syndrome. In 2012, I started a program because opiate abuse was the single most common problem in pregnancy. I did not do my fellowship in high-risk pregnancy in order to take care of women who are addicted to opiates, but this is the epidemic we faced. All right, so we started a program. Based on the understanding that it's a chronic relapsing condition which untreated may lead to severe complications and death, it's treatable, but it's not curable. Retention and treatment is the key, and that's what we needed. We needed a program where women could come, feel safe, get counseling, get medication to take care of the withdrawal symptoms. Being in treatment makes a big difference. If you notice here, the blue line is opiate addicted people dying who are not in treatment. If you're in treatment for 5 years, your risk of dying over the 30 years of this study are pretty much normal. In other words, getting through that 5 years is important. Behavioral changes are needed. Adherence is around 30%. Notice that's similar to asthma, hypertension, and diabetes. And one of the things I'm going to hit a couple times during this is we have a very pejorative attitude towards people who are addicted. They suffer from a disease. All right. The way you should get through the day is to consider them as suffering from a disease, and how do we treat that disease? All right. You're not going to shame them. I still have nurses around me who look down upon these poor souls. All right. When they wake up in the morning, they feel guilty enough. All right. You're not going to add to that burden. I wanted to show you this. This is just showing that over the long term, 20, 25 years, you see these are long-term cohort studies of people who are addicted, and you notice it settles out at about 30 to 35% are abstinent. Look at that red dot up there, all right, with 80% abstinent 25 years after. Wouldn't we like to be able to do what they did? They came home from Vietnam. All right, so what was I supposed to do? Well, there was a medication out there that was being used to treat addicts. And this study came out and showed that it helped the babies as well. Not only did it keep moms off the streets, helped reduce relapses, but there was a shorter duration and less medication needed to treat the baby's withdrawal afterwards. Now, I know it's not very fashionable to say withdrawal, but treat the baby's physical dependence. That's what the NAS is, neonatal abstinence syndrome. And what we see is a significant drop in the days that the babies spend in the hospital, the duration of their symptoms, and the total dose of medication needed to treat them afterwards. So we started a program. We've had about 300 patients come through and deliver by now. One of the fine things is that if you're in the program, your babies go to full term at about the same rate as normal patients. They are normal birth weight, so we don't see the growth restriction that comes from using methadone or drugs off the street. 25% of the babies did not require any treatment after being delivered. Now that means 75% did, yes, but let's look on the positive side, 25% didn't. And if you didn't withdraw, your median hospital day was 6.3 days. If you did withdraw, it was 14 days. If you withdrew because of methadone, it was 28 to 30 days. So it makes a big difference by being in the program. There is a dose dependence, but it's a really very mild dose dependence, and I emphasize in the program is to prevent relapses. Stay in the program, retention and treatment, all right? The small difference in the number of days that the baby will spend in the hospital is not worth risking the relapse. Now, just as an example, the maximum dose we give is 16 milligrams a day. There's a saying in the community that 2 milligrams is halfway through your treatment, which means getting off of that last 2 milligrams is the hardest thing that they're going to do. So, ongoing challenges, still have patient compliance issues. About 30% of patients that we initially transitioned to Subutex don't even show up for their first visit. Well, they got 3 hots in a cot and a prescription for medication. Hopefully they'll be back again. Judgmental attitudes, again, looking down on these people is not worth your while. And it's also based on some misconceptions. Let me tell you about a woman I saw recently. She came to me. She had been given a medication because it made her feel better. And she used it. She was using it when she got pregnant. Wanted to come off of it, got her dose down by about half, but the withdrawal symptoms were just terrible. Just terrible. She stopped using on Friday. By Sunday, she's basically incapacitated. And this is a medication that's known to cause the jitteriness of withdrawal in babies after they're born. You want to look down on that person? She's a nurse, and the medication affects her. All right, so we have labeled these medications, and we have pilloried these medications, and we've demonized these medications, but unfortunately we also demonize the patients that are associated with them. And that's not a really helpful attitude. There are psychiatric comorbidities that are hard to treat as well. Postpartum care, one thing I sit on the maternal mortality review team for the state of West Virginia. In the last several years, the number one cause of death of these young women in the first year postpartum is overdoses. I just had to put this up here. All right, and if you haven't read the book Dreamland, you'll understand this. You will understand this graph. All right, what we see here is the rise in total opiate use. Just look at the black line, and what we see is a tremendous rise in prescription opiate use. What happened in 97, 98? Well, we decided pain was the fifth vital sign, and everybody should get opiates, and everybody got opiates there. And guess what? A whole lot of people got opiates from a company called Purdue Pharma. What happened in 2002? Well, a U.S. attorney, I think, in Virginia, brought Purdue Pharma to criminal court. And I want you to notice that this blue line down here is exactly mirroring this black line fall up here, and that's Purdue Pharma. And that was the source of a whole lot of addicted patients. Now, the problem is they transitioned to heroin, and what we see here is contemporaneously after the fall of the use of OxyContin, we see heroin overdoses starting to go up. I'm not sure what Dr. Yingling has in store for us. Oh, do you know in 2009, drug overdose in young people overtook motor vehicle accidents as the number one cause of death? More people die of drug overdoses. That's just from the government. But if I have something to say about what should be done, all right, this is the experience in France, and what we see in the dark black, all right, is the rate of heroin overdoses, and you see the precipitous fall there, 1996, exactly mirroring the massive rise in the availability of buprenorphine. It's very hard to overdose on buprenorphine. I had one young woman, we had just gotten into the program, she went home and had a fight with her mother. I don't know how many mother-daughter interactions have caused drug overdoses. But this was one. So she took her entire week supply of Subutex that night and came into the hospital. And she was a little bit drowsy, and everybody was worried about her. But one of the advantages of buprenorphine is it's really hard to overdose on it when that's the only thing that you take. And she did just fine. So let's get the buprenorphine out there. Restricting it, I think, drives up the price and just limits access. I would make it even more easy to get a hold of. Every milligram of buprenorphine that gets diverted is a milligram of heroin without being used. So, thank you very much.
Thank you.